Hello everyone, welcome to another beautiful day. My name is Ayodele and welcome to my channel where we talk about different disease conditions in the simplest way so that you can understand. So if you are seeing this, subscribe to my channel, watch, share this video and also do well to engage with it. So today we'll be looking at a very important topic which is diabetes. Diabetes. It is a very important topic. According to my research, diabetes is one of the fastest growing health problems in the world. But what exactly is it? And why does it affect so many people? Today we'll be breaking it down. We'll be breaking it down to a simplest form. So, we'll also talk about what diabetes is, the types, the risk, and how you can live healthier with it if you've got it. Okay? Join me and let us go together. So, diabetes happens when your body struggles to control blood sugar, also called glucose. We all know that the end product of sugar is glucose. So, normally, insulin, which is an hormone produced by the pancreas that we got in our body. Everyone has got a pancreas except those that have taken it out due to one reason or the other. So, this insulin, which is being secreted by the pancreas, it helps to move sugar from your blood into your cells to give you energy. So it moves the sugar into your cells to give you energy. But when you've got diabetes, it's either your body doesn't make enough of this insulin that is needed or it doesn't use it properly. That is the problem of diabetes. So it's either your body is not producing enough insulin or your body is producing it, but it is not making use of it properly. Do you get me? All right, let's go. So when this happens, it causes too much sugar to stay in your blood. It causes too much sugar to stay in your blood, and over time, it will damage your organs. Over time, it damages your organ. That is what, when there is not enough insulin, does to your system. Fine, let's go. What are the three main types of diabetes? We've got three main types of diabetes. The first one is the type 1 diabetes. When we say type 1 diabetes, it means the body doesn't make insulin at all. That person's body is not making insulin. So that person is going to be insulin dependent for life. That person must keep giving his or herself insulin all through the rest of their life. So that is what type 1 diabetes means. And most times it's usually diagnosed in children and young adults. It's usual, that is when they get to diagnose them. And once they have it for life. They have it for life. And they're going to be on insulin for the rest of their lives. So the second one is type 2. This type 2 is the most common one. Most people, most adults have got this type 2 diabetes. And it means that the body produces insulin, but it doesn't use it properly. This body produces insulin, but it doesn't make use of it properly. But this can lead to insulin resistance. And it can be linked to that person's lifestyle, weight, or even genetics. Because if you've got a family member who's got diabetes, especially type 2, you can also have it. There's a tendency that you can also have it. So when someone has got a type 2 diabetes, it means that that person is not using the insulin properly. The body system of that person is not using the insulin properly. And this is the most common one. This is the most common one. The third type of diabetes is the gestational diabetes. Gestational diabetes occurs during pregnancy. It occurs during pregnancy and it goes away after birth. It goes away after birth, but there is always a tendency that a mother that comes down with gestational diabetes might end up with type 2 diabetes later on, even after having that child. So we've got three types. Type 1, that person doesn't produce insulin at all. Type 2, that person produces insulin, but the body system is not using it properly. And the gestational one is during pregnancy. It occurs during pregnancy, but that person also has a tendency of coming down with type 2 even after having that child. You see, diabetes is not something not to pay attention to. All right, let's go. So when you have diabetes and you don't control it, fine. The doctor has already diagnosed you that you've got diabetes, fine. And you leave it uncontrolled, or you don't even know you have diabetes, you don't even know you have that condition. What can actually happen? It can lead to heart disease and stroke. It can lead to heart disease and stroke. It can also lead to kidney failure. It can lead to kidney failure. It can lead to nerve damage, leading to numbness or pain. Most people with diabetes, most times they have this numbness on their hands, under their feet, that when they are stepping on something that is even hot, they don't know. So when you are seeing yourself that this thing is happening to you frequently, you need to go and get yourself checked up. You need to go and get yourself checked up. Another thing is eye problems, which can lead to blindness. Eye problems which can lead to diabetics, can take somebody's eyes away. Diabetics can make somebody go blind. That is one thing about diabetes. Another thing is it can lead to slow healing process. That is one thing you should pay attention to. When you notice that you have a wound and it's not healing on time, you need to pay attention to it. Okay? So, who are at risk of this diabetes? Who are at risk of diabetes? The people are people who are overweight or inactive. That is why it is important to exercise. And if you are overweight, you need to find a way to maintain a healthy weight. It can never be overrated. You need to find a way to maintain a healthy weight. Who are at risk of this diabetes again? People who eat a lot of sugary or processed food. If you are someone that all you eat is processed food and all of that, you are at risk of coming down with diabetes. Also, people who have high blood pressure and high cholesterol, they are also prone to diabetes. People who have a family history are also prone to diabetes. People who are age over 45 are also prone to diabetes. So, what are the signs and symptoms of diabetes? Pay attention to this. The first one is excessive thirst and frequent urination. When you see that you drink water way beyond normal and you go have a wee way beyond normal, you are probably going down with diabetes. Also, unexplained weight loss. When you are losing weight and you don't know, you are already coming down with diabetes. Extreme fatigue, tiredness, blood vision, wound that is not healing on time. But actually, some people do not have symptoms at all. Some people will not come down with symptoms. That is why you need to check yourself. You need to make sure you know what you are doing. So that is diabetes for you. But do you know that diabetes does not have to control your life? With the right knowledge and habit, you can actually live longer. Even if you've got diabetes, if you take your medications, you can live longer and you can maintain the diabetes. So, after this video, go and check your blood sugar level and let me know. Also, encourage your loved ones to check their blood sugar as well. So, if this video has helped you, share this video, comment, and join me on another episode of We Talking About Disease Control.